So Dr. Levy, I'm 28 now. And over the last 8 years or so, I've been on this, a real health journey, I'd say, just learning the real truth about what health really is. Um,
On your personal odyssey, yes.
yeah, exactly. I'm always looking for ways that we can, boost our health and boost especially our brain. I have a bit of not an obsession, but it's just it's something that I'm really focused on is boosting my cognitive function. And I'm seeing that now with methylene blue. I mean, I can't recommend it enough, really. Um, some of the things I really want to touch on as well, which you might be able to elaborate on, is the microbiome and the effects of methylene blue, because I've done a lot of research personally on the microbiome and how so vital that is, and it's not talked about in mainstream medicine, in mainstream pharmaceutical medicine. It's just not mentioned really at all. And how we are destroying the microbiome through all these pharmaceuticals, all these toxins and everything else. And it's often one of the causes really of poor health. So would you mind expanding on, if you wouldn't mind, just sharing your knowledge on the microbiome if you have any, and
Sure.
if methylene blue will negatively impact the microbiome in any way, or
There'll be a very positive impact on it. But it's first important to realize the etiology, the reason for abnormal gut conditions, which are almost always due to an abnormal microbiome that has a greater percentage of pathogens versus good bugs that then cause oxidative stress and poison the ileum so that you get a leaky gut syndrome, so that toxins and pathogens and their products easily go into the bloodstream rather than be filtered out. And then that's the big vicious circle that disseminates pathogens and toxins throughout your body. But it all comes from the mouth. It all comes from the nasal areas, the throat, everything else. When you clean out the mouth, clean out the tonsils, get rid of the pathogen colonization, chronic pathogen colonization inside your nose and throat and upper respiratory tract, the gut heals like you wouldn't believe. I came across this when I first started working with and studying on hydrogen peroxide nebulization. I wrote a book on it in 2021 to deal with COVID, which it's extremely effective at. It'll knock COVID out all by itself early on, and actually it'll knock it out all by itself later stages. Now, again, I'm not recommending somebody do that and nothing else, but it's a very powerful tool. Why is it so powerful? Well, whenever you have bugs from a cold, flu, anything, maybe you had the cold 5 years ago, 10 years ago, if you never took a biofilm stripping agent, biofilm, once pathogens get on the mucosal surface, they quickly build a protective biofilm on top of them. No antibiotic in existence can penetrate that biofilm. So you could have treated yourself with 100 different antibiotics for 100 different reasons. You still have this pathogen colonization in your nose and in your throat from the last time you had the cold and the flu 1 year, 5 years, 10 years, 20 years earlier, unless you took a biofilm stripping procedure, which is hydrogen peroxide, strips out. I'm not saying it's the only thing, but it's by far and away the easiest and cheapest and most biologically and physiologically effective. The peroxide strips out the biofilm, kills the pathogens, and in days, your gut function starts to improve dramatically. I've had people write me in, a child with a teenager with Crohn's disease, horrible, just incapacitated for years, starting nebulizing with the peroxide. In 1 month, he was completely normal. And now that's considered a chronic, incurable disease. And now he's growing again. He's athletic. I mean, and I've had people with mold toxicity. I mean, so horrible. They had to move out of their house. The family's in the ICU. Start nebulizing the hydrogen peroxide. It all disappears, and it all disappears quickly. In your gut, it's oxidative damage. So what are you doing when you have this chronic pathogen colonization is, like the young people say, 24/7, you're swallowing pathogens, you're swallowing the toxins that they make. And when they do finally die, guess what happens? Pathogens thrive on iron. So when they rupture and die, they release a whole ton of free iron, which, remember, I just said, along with copper and calcium, are your two most incredibly pro-oxidant toxic substances they are when they get above a certain level. Anecdotally, let me give you a little anecdote as to what started all this thinking. About 6 years ago, before the pandemic, I wanted to take care of my sinuses. I was researching on my magnesium book, and I ran across nebulization. And I knew what nebulization was, but I'd never really thought about it. Nebulization, of course, for anyone listening, is where you put something into a fine mist and you breathe it in and out and inhale it. Usually different lung conditions, etc. Well, I'd had sinus problem my whole life, so I said, well, let me look a little about nebulization. And I ran across peroxide. I said, wow, that looks like a very good agent. So one day I took out my nebulization mask and nebulized hydrogen peroxide for like 10 or 15 minutes. And having no idea this would happen at all, none whatsoever. The next day, and I'm like 66 years old at the time, the next day, I have the most incredible, perfect, well-formed bowel movement I've ever had in my life. Never had one like that in 66 years of life. That's how quickly it normalized the gut for me. Now, some people that have more gut conditions, it'll take a few days or a few weeks. But the thing is the cells in your gut that are supposed to just, well, the cells in your gut that form a leaky gut, when they get oxidized, they spread apart, they left stuff in. Guess what? You have stem cells in your intestine that give you a new cell every 3 to 5 days, which means if you stop poisoning the gut from above, in 3 to 4 days, you've got a new gut lining. You just got to stop poisoning it on a chronic basis. And I tell you what, before I wrote the book, Rapid Virus Recovery, this was so dramatic, and the information I was gathering was so impressive, that I was thinking of calling the book Rapid Gut Recovery. But it was in the context of the pandemic, and it was much more important to get the concept out there that, well, if you read the book, you'll know it takes care of the gut too, but the most important point for people around the world to get was that when you nebulize hydrogen peroxide correctly, you'll knock out any acute infectious agent of any kind. Any virus, any COVID, any bacteria, anything. And you'll positively impact the gut function. I mean, I had young women that have had years of irritable bowel syndrome, diarrhea all the time. Peroxide nebulization, within a week or two, they're having normal bowel movements. It's pretty amazing stuff.
So we can say then confidently that methylene blue then is not going to negatively impact the
Oh,
microbiome.
not at all. Not at all. I mean, it's yeah, sure. But the thing is you want to use the methylene blue. You still need to knock out the chronic pathogen colonization. Now, if the methylene blue, if you take it in a manner so that it contacts all the tissues, like you gargle with it or something like that, or some people have even nebulized methylene blue, but you deal with a little bit of blue staining there that a lot of people might not want to deal with. So the hydrogen peroxide, no problem with any of that. So they're a tremendous combo. Nebulize with the hydrogen peroxide and take the methylene blue, and whatever the people get my email, if you do this and you get results, write me and tell me about it. I want the feedback. Or if something untoward happens, tell me about that too. But my clinical experience is arm's length now, so I need people to let me know. Let me know. I've had a lot of positive experience already, but it's always good, educates me more, and I can educate other people. I mean, education is a sequential donation process, right?
For sure.